Hello guys, this is Valerie and this is my dental office emergency case study project on Epistaxis. The case scenario: the patient arrives for the routine cleaning appointment at 10 a.m. While reviewing their medical history, the patient states they have been suffering from a sinus infection. The hygienist begins a prophy and the patient experiences an epistaxis event. In this video, we're gonna go over how to treat a patient experiencing epistaxis. The patient arrives for their routine cleaning appointment at 10 a.m. While reviewing their medical history, the patient states they have been suffering from a sinus infection. The hygienist proceeds with prophy, then notice the patient is experiencing an epistaxis event. First, we should identify the severity of the injury. Then the clinician should wear the PPE, personal protection attire. Then we should ensure they have appropriate circulation, has an open airway, and is breathing. Suction may be needed to remove blood from their mouth and maintain an airway. Position the patient upright and have his head tilted slightly forward to prevent blood from entering the throat. Apply direct pressure by pinching the lower part of their nose at least 15 minutes up to 20 minutes. Be sure the patient is breathing. Have a basin available for the patient to spit out any blood and saliva. Place an ice pack over the bridge of the nose. In doing so will help in vasoconstriction. What is epistaxis? It's known as a bleeding from the inside of the nose. It can be spontaneous or induced by nose picking or trauma. There are two types of bleeding, the anterior bleeding and the posterior bleeding. The anterior bleeding is the most common and easy to manage. It's caused by trauma, like nose picking, most often occur in the Kieselbach plexus or the Little's area, which are a group of blood vessels located anterior to the septal wall and close to the mucosa surface. Due to their location, they can be easily broken, and they're most common in children and adolescents. Posterior bleeds is most common on geriatric population, more difficult to manage, occurs in Woodrop's plexus, and is associated with hypertension and arteriosclerosis. In this image, we can see the Kieselbach plexus underlined in yellow and the Woodrop's plexus in orange. Epistaxis has multiple etiologies, and they're often divided into local and systemic factors. The local factors include, but they're not limited to, allergies, cocaine, environmental irritants, foreign bodies, nasal sprays, and others. Systemic factors tend to be significantly more serious and include anemia, anticoagulant therapy, atherosclerosis, blood dyscrasia, hemophilia, and others. The signs and symptoms are going to be clinically visible. Blood will be oozing from the nasal cavity. When it's from the anterior region, the blood is going to be bright red and oozing. When it's from the posterior region, it's going to be dark red, profuse bleeding, bilateral, and it's going to drain into the mouth, causing gagging, coughing, and vomiting. Treatment: identify the mechanism of injury and define the severity. Don personal protection attire. Ensure that the patient has appropriate circulation, has an open airway, and is breathing. Use suction as needed to remove blood from the mouth and maintain an airway. Position the patient upright and have the head tilted slightly forward to prevent blood from entering the throat. Have the patient apply direct pressure by pinching the lower part of their nose for at least 15 minutes up to 20 minutes. Be sure the patient is breathing through the mouth. Keep in reach a basin where the patient can spit out all blood and saliva. Place an ice pack over the bridge of the nose to aid in vasoconstriction. If nosebleed will not stop with direct pressure, it could be a more serious condition, and the patient should be referred to the emergency department. Prevention. The patient should keep his head elevated for 4 hours, not blow the nose for several hours, avoid heavy lifting and bending at the waist for 24 hours. Patients should use humidifier at home to prevent dryness. Apply a pea-sized amount of lubricating cream to each nostril 1 to 3 times per day, and increase water intake and avoid taking any medications containing aspirin.